Hmm?
Not bad.
Not bad at all. Okay. Hello, 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 everybody. Happy Sunday. You know what Sunday means? It is officially the Sunday shift, which is a period of time where we get to sit down. We get to talk to each other about nursing, all things healthcare, all things teas. I mean, really, this is just your opportunity to ask your questions. And I, of course, can hopefully answer some of those questions, put your mind at ease, or at least give you like a realistic, unfiltered version of what healthcare is and kind of what like our role is as healthcare providers. So, excuse me, if this is your first time here, my name is Nurse Chung. I've been a registered nurse now for over 13 years. My background is primarily emergency medicine and critical care, so I do a little bit of both. And I've also done travel nursing, I've done progressive care, I've done med surge, I've done surgery, I've done, goodness gracious, administration, education. I've just kind of had a lot of experience within the healthcare field. So if there is something that you have going on in nursing school, something going on after nursing school that you're worried about, whatever it looks like for you, this is your opportunity for us to sit down, kind of have a little chit chat, figure it out. And I'm happy to answer your questions with the experience that I have. If I don't know the answer, of course, I'll always look it up. We'll figure it out. But hopefully 9 times out of 10, I have a pretty good answer for you. So hello, hello, hello. You have to forgive me. I'm still getting over being sick, so I still have this cough and a little bit of asthma um that's going on right now, so I'm trying to push through that, so we'll see how it goes. Hi Virgo. No, I know. Oh goodness. Well, hopefully it's not broken enough that you could still use it. Happy Sunday, Netta. Happy Sunday. It's just tea. Hello, hello, hello. I see Andrea says, I'm taking my teas on Thursday and I'm very nervous for the science section. Any tips? Great question. So, science recently has gotten, and of course, everybody's test is going to be very different, but science recently has gotten very much like A&P focused based on people who have recently taken the test. So, they're seeing a lot of things specifically about the neurology system as well as the endocrine system. Those are like the top two systems that are like heavily tested right now on the T's. So that'll be really good for you to know. When it comes to chemistry, the biggest things that they're testing on right now is the way that water flows, so like osmosis diffusion, advanced facilitated, advanced, I'm sorry, active transport and things like that. So it's good to know that. It's good to know your mitosis versus your meiosis. They do test on that quite a bit. And then with scientific reasoning, they're more or less testing on different types of tools that are used, light microscopes, TEMs versus SEM microscopes. Those are like the big things that I would know. Like, I can't guarantee that those will be on your test, but those are the most frequently seen things that are appearing right now when it comes to the ATITs. Oh, thanks, Netta. I'm trying to get better. I don't have the nasal congestion anymore, thank goodness. But the cough is staying with me. And with Florida, next week, I believe, it's starting like on the first. We're supposed to be like in the 40s, which is like not a Florida thing. So I'm interested to see how that goes. I got accepted into my nursing school. And it's not the school that I'm graduating from in December. So the school's 2 hours away. The director told me that it'll be 2 to 3 days a week. My current school said. So what I'll tell you, Vane, specifically, is that when I went to nursing school, specifically my graduate degree. So when I was doing nurse practitioner, it took me 3 hours to get to my nurse practitioner. I ended up dropping nurse practitioner just because it wasn't for me. The more that I got into it and the more that I saw how not happy a lot of nurse practitioners were, I ended up dropping out. But I feel you on the fact that you have to drive several times a week to this class. But just know that there's light at the end of the rainbow. You're going to be fantastic. You basically have to be a nurse to take the pre-nursing test the average person could not pass. I wouldn't say that. I wouldn't say that. I personally was not a nurse prior to taking my TEAS test. I did work as an administrator in healthcare, but I wasn't like actually, I wasn't medical smart, if that makes sense. I didn't have a whole lot of background regarding that. So I wouldn't say that you have to be a nurse in order to understand the material. A lot of the material is just based on your prerequisites. I think the biggest thing with any kind of admission exam is that when you were having to be tested on things you took during your prerequisites and you only took that class for like one time for like 5 or 6 months, we tend to either one of two things happen. We weren't really paying attention to begin with. So we didn't really retain the information that we had when we were going through our prerequisites. Or two is that it was so short of a period of time, it was just kind of like pass it and forget it. And that's just kind of what happened. So it's just that's what happens. Did you go the ASN route or the BSN route? Great question. So what I did when I was going through nursing school was I did concurrent BSN, meaning that I attended two schools at the exact same time. I attended Seminole State College of Florida and I attended the University of Central Florida. And those two schools together have a partnership where I could do my bachelor's in a matter of 2.5 years. So while I was taking my associate's classes, I was also taking my bachelor's classes. So every semester I would be enrolled in either 2 or 3 classes, depending on what the semester was. But when I finished my associates in October and I graduated and finished my practicum, I only had 1 semester left of my bachelor's program from January to May, and then I was awarded my bachelor's. So even though I got my associates first, I got my bachelor's like 1 semester later. So that was fantastic. So I kind of did like a concurrent thing as opposed to doing a traditional 4-year BSN program. Does it resemble an accelerated BSN course in course load? That's a great question. Um, I think in some ways it does, and in some ways it doesn't, because with an accelerated BSN, typically, depending on which one you're taking, they're all different. But typically, you have to have like some kind of healthcare experience previously if you're doing like the LPN to accelerated RN, accelerated BSN program. Typically, you have some healthcare beforehand. So I didn't have that. So a lot of the schooling wasn't following necessarily an accelerated BSN program. The associate's program was still that full 2 years. So we didn't actually accelerate anything. It was just the general program. I just happened to take BSN courses on top of my ASN program. So for example, my first semester, I had fundamentals, I had pharmacology, I had that was for my associates. And then for my bachelor's, it was a writing class. And then there was an assessment. So I actually had 4 classes my first semester. And that was during the winter. I took it from January to May. So while I was doing my associates and getting the foundations and the fundamentals in pharmacology, I was also writing a lot of papers and I was also learning like physical assessment pieces based on the BSN program. So accelerated in a way, but not really. It just because I had that kind of course load, I really couldn't work because it really took up a majority of my time.
Someone on Instagram
Oh,
pass exclusively.
I don't see it.
Instagram?
hmm I see where everybody came in, but I don't see any comments. I see where you commented,
Oh, interesting.
but I don't see anything else.
Oh, Chelsea Rice got 80 on T's exclusive using our materials. Got a offer an RN program at Ivy Tech this weekend.
Oh, so Chelsea over on the Instagram side has advised that they got an 80% overall on their exam and they get accepted into nursing school at Ivy.
Ivy Tech this weekend.
Awesome. Huge congratulations. I'm so incredibly proud of you. That's great. and they used our content exclusively. So, our study guides, in case you all didn't know, we have ATIT study guides if you're in that prerequisite stage. We're in the process of updating them based on the most current information. So, a lot of people recently have been using it, and a lot of people have passed their exam, which is fantastic. Huge congratulations to each and every single one of you.
Someone is torn between ultrasound and nursing.
I'm torn between ultrasound and nursing. That's actually a good question. So, ultrasound, I think it's if you're trying to figure out like which one you want to get into, you have to decide how much patient interaction you want to have. I think that's what it comes down to, right? Because as for nursing, you are going to have an extreme amount of patient interaction constantly throughout the day. So depending on like what unit you go to, if you're med surge, you can have anywhere from 5 to 6 patients. PCU anywhere from 3 to 4, and then ICU anywhere from like 1 to 3, depending on like the patient acuity. So you'll have a larger patient load, which means you're going to have a little bit more responsibilities depending on where you're at. And you're also going to have a lot more hands-on with nursing. So a lot of IVs, drips, dressing changes, wiping butt, you know, helping patients eat. Like there's just a lot more that's required of nursing as opposed to ultrasound. So ultrasound, when you're doing something like that, is you're getting patients as they're coming in. You have them for a set period of time, however long the ultrasound lasts. And then you ship them back to where they're going. The only difference between like nursing and ultrasound that could be a make or break it is that some hospitals will require you to do on call as an ultrasound tech. So if you maybe work for one hospital and that hospital has like an ER someplace that's off site, you may float to that ER and do ultrasound there depending on what your call is. Sometimes it just really depends. It just really depends on what's going on. So if you're good with like being on call, having limited patient interaction and just doing that one monotonous thing over and over and over again, then I would say do ultrasound. If you want to have more opportunities in regards to advancement, if you want more interaction with patients, if you want to develop a more critical care type of thinking mindset, something like that, then I would say go with nursing. Personally, with me, I always choose nursing over everything else just because of the trajectory and the path that you can take, depending on what it is that you want to do as you move forward in the future. Do you recommend to work full time during nursing school? I currently live by myself and the bills gotta be paid. I love that. So here's the deal when it comes to working full time in nursing. Is it possible? Yes. Is it really difficult? Yes. When it comes to working, depending on the kind of nursing school that you're going to, will heavily influence if you can maintain a full time job. And the other thing that you're going to have to recognize is that if you have a full-time job, that full-time job has to be flexible with your nursing school schedule because this is what happens. A lot of times you're going to have clinicals that are going to change. You're going to have simulations that weren't initially scheduled that are going to pop up. You're going to have maybe class time or test times that maybe change. And you're going to have to be able to attend all of them. You can't miss any of that because if you miss any clinicals, you miss any simulations, you miss any testing, there's no guarantee that they're going to give you a second opportunity to take it again. So my biggest recommendation for you is that if you are in a situation that might be a little bit more difficult, maybe you would want to start with something, maybe a little bit more flexible, maybe do LPN first. So that way you can get your degree quicker, but your LPN will be a little bit more flexible with your career. The RN program, I will tell you, they are not flexible at all. I missed one clinical and I had to pay them to go to that clinical. I had to pay them because I missed that clinical because they had to have somebody come in for all the people that missed the clinical. And it was just like a whole group of us that happened to miss like 1 or 2 days that had to go in. And I had to pay $120 because I missed that clinical. So just be very cognizant of that. you will have to have a career that's very flexible, and sometimes that's a little bit hard with having a full-time position. Aw, thanks, Brandon. You're so sweet. Would you say there's a way to master dosage calculation, especially dimensional analysis by Thursday?
Practice question.
Practice question, practice question, practice question. I do have a couple videos over on my channel of dimensional analysis and things like that. Highly recommend that you check that out. You're just honestly at this point, because you're on a little bit of a time crunch, you're really gonna have to put in that time to get those dosage calculations down. But it's not like impossible. I wouldn't say that. Let me see.
Is the concurrent program available for a lot of school? Someone asked.
Is a concurrent program available for a lot of schools? I don't know, to be fully transparent with you. I know that when I went to Seminole State UCF, we were the first class. So I was the very first group of people that was part of this program. It was like a new partnership that they had. So I'm not 100% sure if a lot of schools have it, but I feel like if you type in like ASN, BSN concurrent program in your state, you probably would find something. But I just can't guarantee that all the schools have that program. What does the first semester of nursing school consist of? I want to start studying. Great question. So it depends. Every school is a little bit different in what they teach in the first semester. I can speak on my experience. I took fundamentals and pharmacology in my first semester together. So nowadays, pharmacology is kind of getting sprinkled in between like your all your med surg classes. You're getting a little pharmacology there. I had to take pharmacology as a completely separate thing. So your first semester specifically is always going to have some kind of fundamentals pieces. So you're going to learn all the fundamental things. So like fluid and electrolytes, vital signs, how to do a patient assessment, basic skills like Foley's, things like that. You're going to learn the Maslow's hierarchy of needs, a lot of pain management, infection prevention, things just like that are the foundation of the stuff that you need to know in order to be a nurse. So what I would say is that a lot of this information outside of like assessment pieces, like vital signs and things like that, help prepare you to be a patient care technician on a hospital unit. Because typically once you pass your first semester of nursing school, you can work as a patient care technician because you have learned those vital skills that CNAs would have learned during their schooling. So you'll learn that. And then with pharmacology, it was a lot of, categorizing medications, what the medication mechanism of action was, what the side effects of the medication was. Is there any interactions for that medication when it comes to food, environment, or other medications? And then who you would give these medications to, what indications would require these medications, and how would you provide an assessment in order for that medication to be considered safe. So that was a bunch of the stuff that I learned in my first semester. I will tell you that first semester, not to say that none of the semesters are hard, but that first semester is more difficult than most because you're trying to figure out how to study. You're trying to figure out how to stay organized as you're going through the program. So it will be a little bit difficult the first semester. Just hang in tight. The chaos will get organized at some point. It's a little scary the first time you go around. How much is CRNA school? That's a great question. Depends on the school, but I hear it's really expensive. I know that I've seen some people that they paid like $250,000, and I've seen other like highly prestigious schools where they paid even more than that to become a certified registered nurse anesthetist. So it depends. It depends on where you're going, but it is very expensive. I do know that CRNAs get paid a lot. It takes some time. It's just kind of like being a doctor almost. Initially, you might not necessarily get paid a whole lot. And then over time, as you gain more experience, you'll gain more money with that experience. So it will take you some time to pay off those student loans. Just be prepared for that. But a lot of people like it, and a lot of people say it's worth it. Placing someone do a BSN while still in an associate's program. So typically, they will not let you do a bachelor's program if you have not finished your associates. If the schools have a relationship where, like my school had, where they had a concurrent thing going on, then obviously you could do your bachelor's and your associates at the same time. But typically, BSN programs want to see that you're one, already a nurse, and two, that you finished your associates. Is there any trade schools between RN or a CNA? What do you, or to become an RN or a CNA? I don't know what you mean, Jacob, by trade schools. I wouldn't say that there's like trade schools. You mean like when you're trying to become like a medical assistant or something like that, that like those kind of trade schools? I would say no. Most of the time you're either gonna have to go to a university, a community college, or a specific kind of college like Rasmussen, Herzing, like those types of colleges specifically to become an RN. I don't think that there's necessarily like a trade school for RN. And CRNA is even more structured. There's a lot of like regulations and things that you have to follow. So a lot of the CRNA schools are most likely going to be your universities that you're going to take them at. Opinion on Internal College of Health Science. What do you mean, Kayla? I'm confused by what you mean, Internal College of Health Sciences. Have you ever seen a nurse go from BSN to MD over the course of their career? Yeah, actually, I have a really good story about that. So I had a really good friend when I was working at orthopedics, med surge, and he was an RN. He was an RN for a period of time. Prior to that, he actually worked in the military. So him and his wife both were originally in the military. They got married, they got their RN, and they were working for an RN for a long period of time. Well, during our course of us being in the orthopedic unit together, they decided to go back to school to get their medical degree. So they both decided, he went first, I believe, and then she went second. I don't know. Don't quote me on that. She might have went first. But anyways, they moved to the West Coast. They both went to medical school and got their doctorate in medicine. And as far as I know, they're still over there. But yeah, I have seen people become RNs and then eventually go back to get their medical degree. I personally have experienced that. Do I have to have 2 years of bedside before switching to soft nursing? No. No. You can have as much nursing as you want. I will tell you is if you wanted to switch from like ICU to PACU, which is what a lot of people do, you will have to have at least 2 years. Depends on the soft nursing that you want to do. Oh, you're welcome, Miriama.
What do you think about hybrid program? Do some lecture via Zoom and labs on campus.
I don't think there's anything wrong with that. I think as long as you're paying attention during a hybrid program and you're actually learning the material, I think that you'll be okay. I think what typically happens with hybrid programs, which is why I'm not a huge fan of them, is that students may put on the lecture and then fall asleep and they're not actually paying attention to the lecture. And then in certain situations where they are taking their tests, they maybe aren't as necessarily truthful all the time. I'm not saying this is everybody, but there are a select group that aren't necessarily truthful when it comes to their tests. So they may be cheating or they may be using services to take their tests for them. And that's what I think is the problem with a lot of hybrid programs is there's no way to really regulate that. But if you're the type of person that you are, which I'm sure that you are, you're not going to be the type of person that cheats and that you're going to hold yourself accountable. I think you're going to be just fine.
Why do RN have to get their BSN in some places? What's the difference?
So why do RNs have to get their BSN in some places? What's the difference? So here's the thing. You don't have to get your bachelor's degree in order to be a nurse. I'll say that first. You can have an associate's degree and still be a nurse. There's a ton of people out there that just have their associates and they're doing just fine. Here's the reason why you have to have your bachelor's degree is because a lot of times, especially in the more prestigious hospitals, you are going to be working for The hospital itself, I should say, should be working for magnet status. So magnet status is a kind of prestigious kind of status that hospitals gets to say our nurses are the best of the best. They're fantastic. They're highly trained. They're highly educated, and we're the best of the best. That's what a lot of hospitals want to have, right? So in order to achieve that, they have to have a certain percentage of nurses that have their bachelor's degree. Typically, they will hire you with your associate's degree with the expectation that over a period of time, you will complete your bachelor's as soon as you start working there. So that is pretty much the reason why you have to have your bachelor's degree. I know that there's a lot of hospitals right now that are only taking nurses with BSNs. Not every hospital, but there is a lot of hospitals, especially those that are like level 1 trauma centers, magnet hospitals, stroke centers, cardiovascular centers, all of those different kinds of centers, they are wanting you to already have your bachelor's degree when you come in because those are the candidates that they're looking for. Then they don't have to hope that you're going to go back and do your BSN because I can tell you from working with administration and working with a magnet hospital that we have hired some individuals that agreed to get their bachelor's degree in a certain period of time, and they never did it. And unfortunately, the hospital had to let them go because that was part of their contract when they signed on. So just be cognizant of that. But yeah, there are a lot of hospitals that are wanting you to have your BSN prior to coming. Especially if you're going for those more, if you're going for like a more rural hospital or something like that, I don't think they care as much, or a smaller hospital. But if you're going for like the bigger hospitals and more prestigious hospitals, if you're trying to get into like labor and delivery, NICU, like those like high areas as well, they're going to want you to have your BSN.
Are you an NCLEX tutor,
No.
or what is your is this your full time job, or you work something on the side? Someone asking your credentials.
Okay, so somebody asked if I was an NCLEX tutor. So have I? What was that?
I can squeeze in.
Oh, somebody asked me if I was an NCLEX tutor. I'm gonna put my hair down, y'all, because my hair looks horrible right now. It's driving me insane. Am I an NCLEX tutor? So have I been teaching NCLEX or NCLEX topics? Yes. Would I call myself a tutor? No. I would call myself a tutor, but I am working on things to help you with your NCLEX. So at some point, yeah, I will be an NCLEX tutor. What do I do outside of this? So outside of doing online teaching and the things that you know me for, I also work as a critical care registered nurse, I'm a training program manager for intensive care purposes. So basically, like all of the critical care programs that you all do, that you go through, whether you're going through PCU, ICU, things like that, I developed the programming for that for my hospital and my region. So a lot of like simulations, onboarding, follow through, graduation from it, all of that stuff. That's what I do specifically. So very intensivist, very like ER, ICU, PCU, things like that. Like those are the programs that I build for. Yeah, I probably honestly need to wash it. It's a little greasy, but we'll get there.
If a hospital pay you for the BSN, how long is the usually commitment with them?
So if the hospital pays for your BSN, how long is usually the commitment? So here's the deal. If you allow the hospital to pay for your education, what I will say is that typically, depending on the hospital, they will require you to sign a 2-year agreement that runs as they pay for your stuff. So basically, if they pay for your program and you graduate in October of 2025, they would expect that you would continue to work with them until October of 2027. That's usually the commitment. There are some hospital organizations that will not require you to sign a agreement that they will pay for your education. It's kind of like a good faith type of deal. But there are some hospitals that will make you sign it. And I will tell you from personal experience that if you do not give them the 2 years, they are more and more coming after nurses for that money to be paid back. I worked for an organization when I was a brand new CVICU nurse. They paid for a portion of my education. And when I had left due to a toxic workplace and things that I just didn't agree with, I unfortunately had to pay back. How much did I have to pay back? It was a lot.
16.
It was a lot of money. We're talk tens of thousands I had to pay back because of that. So just be cognizant of it. Just be cognizant of it. If you wanted to pay for it, great, but just know you can't leave because they will come after you.
Do associate nurses get paid less than BSN nurses?
Associate nurses do get paid less than a BSN nurses, but I wouldn't say it's like a significant difference. I think that if you're looking like at pay difference, typically what hospitals are looking at is they're looking at how many years of experience you have. Do you have any like certifications? So like for me, I have my critical care registered nurse certification. So they look at that and they look at um so how many years you've worked, your certifications, and how much experience you have on the unit that you're going to. So say for example that I worked in the ER for 5 years, right? Concurrently before I did education. In that 5 years, I got paid an increase based on the 5 years that I worked, plus the fact that I was going into a role where I had already had the ER experience for that role. So I got paid more money. The other thing is that if you're looking for more money, this is going to be my number one tip, is do not stay at a hospital longer than a year or two at max, because this is what happens every year when you go for your yearly evaluation. They do not pay you what you are worth every single year when you go for that evaluation. You may get like a dollar, maybe $1.25 more an hour. I mean, if we're lucky, let's be honest, if we're lucky. But typically they don't give you a whole lot of money from year to year. If you left that hospital and went to work for a completely different organization, now remember, when you leave the hospital, make sure you give your 2 weeks because you want to go back probably. Put in your time that they want of you. But when you go to another organization for that 1 year is going to be worth a lot more to that other organization than it would have been worth at the one that you were staying at. So my biggest recommendation to you is that if you are wanting to really optimize your earnings in regards to healthcare and what you can make, you can't stay at the same place for too long. I always say at least 1 year, 2 years max. 2 years max. If you reach 1 year and you're like, I'm really not comfortable in this setting yet, like maybe you're a CVICU nurse and you want to spend a little bit more time, do another year. It's completely fine to stay someplace for that long, but you're going to have to leave after that 2 years. And some of you are going to build relationships with people, you're going to build friendships. And it's going to be hard for you to leave. If money isn't a big deal to you, don't worry about it. But if money is a big deal to you, you have got to go someplace else. That's how you're going to make the most of your time and what you're worth. Unfortunately, there's too many people that stay in the same job. Like I worked with somebody, he had been in the same hospital since he was a nurse technician going through nursing school. And he was still there. And I'm talking years and years and years. And when I found out how much he got paid, I was making $15 more an hour than this individual was getting paid. 15 more an hour. And I'm telling you that they don't pay you for loyalty.
And that was pre-pandemic.
And that was pre-COVID pandemic. So
Awesome.
so COVID prices obviously for nursing has changed since then. But I mean, it was a significant difference, a significant difference. They don't pay you for loyalty. So just be cognizant of that. If you are the type of person that's getting in it for the money, and that's completely fine. There's absolutely nothing wrong with that. Nobody works for free. Just know that that is how you're going to have to do it in order to get paid what you want to get paid.
Did LPN experience count towards your RN job?
LPN experience does count towards RN, but at a different rate when it comes to hospitals. So LPN, because your scope of practice is very different from what a registered nurse's scope of practice is, they do give you credit in regards to how much they pay you in the hospital setting, but it is at a different percentage than RN. So that's what I will say. When you become a graduate nurse, you will get paid a little bit more as a graduate nurse, having already had the LPN experience. Um, but it's just not like as a top tier, like if you were going from RN to RN to RN type of deal.
And remember that guy who we were talking about trying to switch role, they're trying to give him a pay cut.
Oh, so yeah, and the guy that I was working with, when he went from being a bedside nurse to being management, he got a huge pay increase. So what he originally did, let me just give you like a little background. What he originally did was is he went from a bedside nurse to an assistant nurse manager. He didn't really like the assistant nurse manager thing. It wasn't for him. But he got a huge pay increase in between those two roles because he went from bedside to management. When he went from management to education shortly after that, they actually was trying to take money back. So they were trying to say, well, your role, they were trying to say that education and bedside nursing made the exact same amount of money, which didn't make a whole lot of sense to me. That's just me. But they were actually trying to take money back from him and basically said that education was a demotion from management because that's how the hospital um treated their educators, if we're being honest. They
Interesting.
treated it as a
No idea.
demotion. And I still got paid more than him, even with him getting that huge rage going into management. So, yeah,
So any advice?
loyalty doesn't pay anymore.
Any advice for anyone that start nursing school next year? What they're gonna do now? What they need to prepare?
So, any advice if you're starting nursing school next year? So, if you haven't already figured out what school you want to go to, now would be the time to do so. If you have a couple different options, look to see what their admission criteria is, what it is that they want from you prior to submitting applications. If you have to take T's, if you have to take HESI, Kaplan, whatever it looks like, start studying that now. That's going to be really important for you. Pass that T's, that HESI, that Kaplan, whatever it is that you're supposed to take, and then spend a lot of time really honing in on your anatomy and physiology. Your teachers are going to tell you, I am not here to teach you anatomy and physiology. You should already know that because you took 2 semesters of it and passed those classes. So they won't teach you anatomy and physiology. You will need to know that like the back of your hand. Is going to be so important when you're going through nursing school to know that. Number one, know your dosage calculation. If you can figure out dosage calculation early, you're saving yourself a whole lot of headache later on down the road. And then know your medical terminology, because at the end of the day, if you can break down concepts, break down words with medical terminology, you'll be able to figure out what these medical words actually mean, and why they're important. So that's my biggest thing. Also, work on time management, work on your study habits, the way you retain information, things like that. I think you'll be all set.
How about clinical next year?
Starting clinical in January, any advice? Clinical is going to be fun. So here's the deal. Clinical is what you make it. So if you're the type of person that goes in, you do the bare minimum, you're going to get the bare minimum out of it. If you're the type of person that really looks out for opportunities, you want to see different things, clinicals, you're not necessarily going to be assigned a patient load, especially like your first semester. You're really just trying to like figure out healthcare as a whole. So you're kind of there to help everybody out for whatever they need. But if there's certain things going on, like somebody's getting a chest tube, or somebody's going down for surgery, or somebody's on some really like extensive drips, like if you seek out those opportunities will come to you. Your instructor is not going to find you and ask you if you want to see this a majority of the time. You have to be the person that has to be the go-getter that actually wants to go see those things. So my biggest recommendation to you when it comes to clinicals is make sure you're paying attention. Make sure that you are seeking out those opportunities and really just have fun. Clinicals are meant to be fun. There's going to be a lot of things that are going to happen in the hospital that you're going to be like, oh my goodness, like what's happening right now? You're going to encounter those things, but that's okay. That's what makes clinicals really fun. And remember, don't do anything unless you have a nurse with you. So recently in Tennessee, I think, right? In Tennessee, there's a gentleman that is currently in a lawsuit. He's just a brand new nurse, but he's currently in a lawsuit because while he was in clinicals, he went to go help a patient either back to bed or out of bed. Don't quote me on that. I don't know what it was, but he was trying to help them. They ended up falling. They had a massive cerebral bleed. I think it was like a they had some kind of brain bleed. Don't quote me on that. I can't remember what it was. But Years later, after this happened, when the family sued the hospital and they settled out of court, the hospital went back to the school to say, well, it was your student who did this. You all were responsible for it. And there was no nurse helping him or nobody, professor, nobody was there. You all need to pay this settlement. And now there's this huge
Oh,
lawsuit going on right now.
Florida.
Was it Florida? I couldn't remember where it was.
Rasmussen.
Of course, it's Florida. Everything happens in Florida. That's why I live in Florida. It's just always Rasmussen, right? Is a Rasmussen student. And now this Rasmussen student is also part of this lawsuit because of this incident that had occurred in California. That's what it is. I couldn't remember. There's so much that's happened in Florida. I was hoping it was someplace else. But just know when it comes to clinicals, my biggest advice to you is that you do not touch a patient unless there is a nurse there with you. Never do something by yourself. Never do something that could be unwitnessed. If a nurse decides that they leave the room and they leave you there, you don't stay there. You go with the nurse because there's just so many things that could potentially happen and you don't want to be in the situation like that poor nurse is right now that was just trying to help. And they're in this like major lawsuit because of what happened.
And keep once you get your license and everything, keep your personal information safe.
Yeah. Oh, and the other thing is when it doesn't matter. There's no way to keep it safe. Here's the deal, y'all. There's a lot of stuff on the news right now about nurses who have had their identities stolen and other people pretending to be them and working with their license. This is happening nationally. This isn't just like Florida. Don't get me wrong, a lot of stuff happens in Florida. But this is like nationally. I think there was a nurse out west that this happened to too, where they basically just looked up somebody's name online. It was close to their name, and they took their license and they went to practice. There's a lot of things I'm a little bit irritated with the Board of Nursing in the United States that there's no way for them to make sure that we're identifying people as actually having the license as opposed to just having the name. And a lot of things are happening where like accidents are happening, patients are getting harmed because these nurses don't have experience in healthcare and are basically practicing under somebody else's license. There was another guy in Florida. It's happening everywhere. There's two people in Florida. There was one named Autumn down in Southern Florida, I believe was their name, and they took their friend's name from school. There was two Autumns in their school. She took her friend's name from school and then went to apply for a job because she failed the NCLEX is what happened originally the first time. She failed it, went to apply for a job and said, oh, I got married, so my last name's different. And the hospital let her work. That's crazy to me without verifying that. So and she only got caught was because she applied to be a charge nurse, and that was when they went back to her file and they didn't have any of the appropriate documentation that they needed to prove that it was her. So I'm pretty sure she's going to lose her license that she worked very hard for and finally was able to pass. I'm pretty sure that's going away. I don't know yet. We'll see how it goes. But then there was another guy in Florida that took his roommate's license. He was previously licensed as an RN. He had experience, but he lost it because he was diverting drugs from patients and taking the drugs for himself. And he had a whole thing with the Board of Nursing that they investigated it, and he lost his license. So instead of just dealing with that, he took his roommate's RN license and went to apply for a job at a hospital. And the only reason they found out about it was because the nurse manager was like, oh, I don't think this is that guy. I don't think this is this. I don't think that he's being truthful. And they ended up finding out he wasn't. But I'm just, at the end of the day, it's just to say that your information is online. If you wanted to look up my RN license, you could look up my RN license. You will find it. You'll find it in the Florida Board of Nursing. And you just have to be careful because there's a lot of people that, because that information is so public, that they could potentially steal your identity and this could happen. So be very cognizant of it and just make sure that you're protecting yourself and protecting your license. It's crazy. Florida's a mess.
Yeah. We're leaving.
Yeah, we're most likely leaving Florida, just so that you all know. Just because my family lives in Alabama and Tennessee, and I want to be closer to my family. So there's a very good chance that I will be leaving Florida and either going to one of those two states. So we'll see how it goes. But yeah.
So someone having a nurse residency interview coming up in a mass search unit, how would they prepare?
So somebody's having a medical surgical interview in the hospital. How should they prepare for that? So here's the deal. And I hate to say this, and people are going to be like, Nurse Chung, don't tell people that. But here's the deal. At the end of the day, you're probably going to have to lie during your interview. I don't know if you're an experienced nurse or if you're a graduate nurse. Obviously, those interviews are going to look very different. I'm going to assume you're a graduate nurse. That's what I'm going to assume. So, as a graduate nurse, interviewing for a hospital, especially if it's a hospital you really, really want to work at, there's a couple things you need to do. Number one is you need to look up the hospital and see like what's going on at the hospital. Do they have some kind of big initiative going on? Are they building another building for something? Are they trying to get like some kind of certification or something like that? Like, there's got to be something specifically they're working on. That's what you're going to mention during your interview when they ask you, why do you want to work here? 9 times out of 10, they're going to ask you that question. Why is it this hospital that you want to work at? So say, for example, the hospital is trying to get stroke certified, right? And you're going in for an interview and they go, why do you want to work here? You would basically say, hey, I heard that your hospital is doing blah, 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 trying to get the stroke certification. I'm really interested in that. I think that that's really cool that this hospital is advancing their footprint on the community. And it just sounds like something I want to be a part of. Huh? Huh? Did that sound good? Yeah. See, that's exactly what the people are going to be like when they're interviewing. They're going to be like, oh, this person did some research on our hospital and brought up something that's going on. Hey. So start doing your research on the hospital, see what's going on. And then the typical questions are always going to ask you no matter where you go. What are your strengths? What are your weaknesses? Don't give them an actual weakness. Y'all, some of y'all are too honest when it comes to interviewing. Some of y'all are way too honest when it comes to interviewing. You'll be like, oh, well, sometimes I wake up late. Why? I can't tell you how many interviews I've been on that people said things to me that I was like, I had one person say, oh, sometimes I wake up late. Oh, I like to skip around between jobs a lot. Like, do you know what I'm like? Don't be too honest during an interview. Make up some stupid kind of weakness and be like, oh, I care too much. I was told by a manager that I cared too much or something like that. Like, come up with something silly, not like an actual weakness. Because when you say things like that, especially if you're going for a more competitive type of unit, med-surg not necessarily competitive, but like any other kind of unit, then I would say don't be too honest. They're always going to ask you like some kind of clinical type of questions like, this is what's happening. What do you think is going on? 9 times out of 10, it's going to be a sepsis type of question. They want to see if you can identify sepsis with fever, increased white blood cell counts, things like that. They're going to ask you about a time that you took care of a patient and how did you go above and beyond. Come up with some kind, even if you don't have any kind of answer right now, come up with some kind of ridiculous thing when you were going through clinicals about how you went above and beyond for the patient. That just sounds like, oh, wow, they really like went out of their way to to actually help these patients. Um, yeah, I'm going to be honest with you. The hospital is going to lie to you. It's okay to lie to the hospital as long as you're not lying about things that you don't have experience in. If you're going to go into the hospital and say, "Oh yeah, I've touched a whole bunch of chest tubes, I've extubated patients," and you've never done those things, that's not going to be good. But be honest, but also lie at the same time to make yourself sound better. I know that sounds really bad coming from Nurse Cheung, but the only reason I say that is that I've done a bunch of interviews in my life, and I've done interviews where I was completely honest about my experience and not necessarily have gotten anywhere. And I've done a bunch of experience where I basically bull crapped my way through that entire interview and I rose to the top. So it's okay. Hospitals, when you ask questions for the hospital, when you say, hey, what's my patient to nurse ratio? And they tell you, oh, it's 3 to 4. And then you go in there and realize it's more like 5 to 6 patients per shift. They're not always going to be honest with you. So it's okay. It's okay to lie as long as you don't lie too much. Uh,
Someone asked, I don't know if you can say anything on that. Advent Health versus Orlando Health.
oh, y'all are trying to kill me. Who asked that?
Yeah, someone in
Alejandra. Advent Health versus Orlando Health. This is what I will say. I worked at both. Number one, I worked at ORMC, Dr. Phillips Hospital, Advent Health Orlando, Advent Health East Orlando, Advent Health Winter Park, and probably some other ones that I can't think about it. Out of all the places that I worked,
They all have their strengths and weaknesses.
I'm trying to think, like, personally, and this is just me, I would rather work for Advent Health. And here's the reason why. There's nothing wrong with Orlando Health. I'm not saying there's anything wrong with it. However, with Advent Health, I felt that they cared for their employees a little bit more in comparison to Orlando Health. They had a lot more resources in regards to like health and wellness and employee mental health and things like that. In comparison to the other one. And again, this has been a little bit since I've worked there. So I don't know if Orlando Health has those things now. I'm just speaking from personal experience. But they had a lot more incentives for being an employee. If you are the type of person that wants to work in a faith-based organization, then obviously Advent Health would be the hospital that you would want to work at. Typically in the mornings, we would pray or have some kind of like devotion, something like that. They both have their issues, y'all. I'm going to be 100% transparent with you. Every hospital, whether it's those two or anything else, I've also worked for HCA as well in the Orlando area. They all have their issues. It's just you have to figure out what issue you're willing to accept and what you're willing to work with. But in comparison between the two, having worked at both Orlando Health and Advent Health, I would probably say Advent Health would be my number one choice. Orlando Health would be my second choice, and then HCA would be my last choice in the area specifically. And I have worked at Halifax. Oh my God, I've worked at all these hospitals. Health Central, I've worked at all of them.
No jumping around.
I've been around. I've done a lot of travel contracts. I did work at Halifax as well. Halifax is an older hospital is what I would say, specifically when I worked there. I can only speak when I worked there, but it is an older hospital. Elevators are a little creaky. Sometimes I would get into an elevator and I would freak out that the elevator was going to give up. But the staff was really nice. The management I worked with wasn't great. Hopefully they've switched management since then. Their ER manager at the time was like fantastic. I loved him. He was very kind, and cared about his staff a lot. But the other units, which will remain nameless, the manager wasn't very nice. And that was the reason that I had left. So,
Easier to get into.
but much easier to get into. I mean, overall, like a really good hospital. I mean, it's right there off of like I-4 and 95. It's like right on the corner there. I drove from Orlando up there when I was trying to figure out how to be a nurse. A really nice hospital. There's nothing really wrong with it. It's just an older hospital. It's an older one. Yeah, you're welcome. Listen, every hospital has its issues, y'all. Every hospital has its issues. Unfortunately, you just have to pick what your issue is, you know? And don't stay at a hospital too long. None of these hospitals are going to pay you for your loyalty. They're just not. I went back and forth between OH and AH. I can't count how many times. It was a lot because I was trying to increase what I was getting paid as a nurse because every year my increase every year for having worked there for an entire year was like usually like 75 cents. There was one year it was 25 cents.
Yeah.
You remember that year that they were like, we're going to give you a quarter extra. Thank you so much. And I exceeded expectations.
Mm-hmm.
They just don't pay you for your loyalty.
What is the expected timeline for new grad to get a new grad RN job?
What is the expected timeline for a new grad to get a new grad RN job? Depends. It depends on where you want to work and what you're willing to do. So I will tell you that there's a lot of people that come out of school and they'll be like, I absolutely am not working night shift. I refuse to work night shift. But sometimes if you want to get your foot in a door with a more competitive kind of unit, you may have to start out on nights. I did it when I first became a nurse. I was working in the ER at nights. actually did that for 2 years. 2 years before I switched to day shift. But if you want to get into a more competitive unit, you might have to make the adjustment to nights for a temporary period of time. So if you're willing to have a flexible schedule between day and nights, that will help you. If you are wanting to get into a more competitive unit like labor and delivery, NICU, ICU, ICC sometimes can be a little competitive, ER, any of those more like highly competitive units, it may take you a little bit longer. If you're a little bit more flexible in the beginning, maybe you want to do a med surge, maybe you want to do a PCU, maybe you want to do something like that, then I think you could probably get in quicker. But it's really up to you with how flexible you want to be.
So, someone asked, CNA program or sonogram tech?
Oh,
Based on money, future, and
to be honest with you, I wouldn't be a CNA. I hate to say that. I love my certified nursing assistants. Like you don't even like know how much I appreciate them and what they do, but y'all don't get paid enough as CNAs. I'm going to be 100% transparent with you. They do not pay CNAs what they're really worth. If we're being fully transparent, you all do just above and beyond like things in the hospital, and it really irritates me that they just don't they just don't recognize that. They just don't pay you for that at the end of the day. So my biggest thing is like, if you really want to be a CNA and you have the passion for it, do it. But you can make more money working as a janitor at Buc-ee's, which is a gas station for those of you who don't know what it is, than working as a CNA, doing way less responsibilities. So I don't know a whole lot about sonographer technicians, like what they specifically get paid. But based on what I think it is that they do in their role, I would say do that. And I hate to say that. I hate this because like units like are desperate to have nursing assistants in some capacity, but they just don't pay you well or recognize that. And I hate that. I hate that so much. So I don't personally recommend CNA just because of that. If you have an option to do something else and it's not something that you really want to do, I would say do something else.
CNA is worth it to get into nursing school.
Yeah, CNA is worth it in that aspect if you're trying to get into nursing school and you want to have experience. Because, yes, if you're going to a college where they look at previous experience, if you have any volunteer hours or any kind of healthcare experience, that will absolutely help you with your applications when it comes to getting into nursing school. But if you are just doing it with no hopes of becoming an RN, LPN, whatever it is, something like of a higher advanced degree, then I would say don't do it. It's not worth it.
So for the CNA and sonogram tech, they want some program that can be done within a year or less
Okay.
because someone need a job. Which
Oh.
one will get paid better if the
Ye-
route?
I don't know a whole lot about sonogram tech. I'm going to be 100% transparent with you. If you are wanting to if you wanted to get schooling done quicker and get to work quicker, then I would probably say CNA. It doesn't take a whole lot of time, probably like a couple months, depending on what the CNA program is. If you have a CNA program that also does like phlebotomy, where you can also do like blood draws and things like that, then that might take a little bit longer, but CNA typically you'll get done much quicker. Then I would say if you're trying to like get that money now, then go for it. But just know, don't shoot the messenger. Just know that if you get the job and they offer you like $12.50 an hour or less, or maybe a little bit more, that's kind of what you're looking at. Yeah, 4 weeks. Yeah, everybody, the CNA is very different depending on what the school is.
And someone, say a medical assistant or PCT might be better than CNA.
Yeah, medical assistant, I think that you have, the problem is, and depending on where no, I'm thinking. So the problem is depending on where you are. So like specifically like in the state of Florida, medical assistants don't have as many job opportunities as CNAs. So a CNA, hospitals are like begging for CNAs, right? Begging for CNAs. And I see that in Georgia, CNAs are making $23 an hour now. Wow. Then I say go for it. I can tell you in the state of Florida, they don't make that much, anywhere near that much. CNAs in California are making 30. But the thing is with California is that the cost of living up there is insane. The cost of living up there is like crazy. So you have to kind of like figure it out. I can tell you in Florida being a CNA, probably not a good idea. That's just like personal experience and what I've seen CNAs getting paid based on the hospitals here. But yeah, usually CNAs, you can get it done with like a month or two, maybe a little bit longer if you do phlebotomy, be done with it, be over with it. And you're always going to have a job. I guess that's the one good thing about a CNA is like you're needed everywhere. There's not going to be a unit that doesn't want to have a CNA. So if you wanted to work different aspects in hospitals, CNA would be good. CNAs in Florida is not worth it. I'll just say that. Miss Education says CNAs in California do not make $30 an hour. I'm sorry. Yeah. Y'all don't get paid for what you do. That's just what it comes down to at the end of the day. And neither do nurses.
So if from phlebotomy tech, would you recommend if instead of being CNA, being a
Being a phlebotomy tech, I would rather do that.
Yeah. So
Yeah, like phlebotomy tech to me personally would be way better than being a CNA. One, you're not having to deal with basically like CNAs are there to do a couple things. And then again, this is just based on personal experience. They're there to help with like restroom assistance, feeding assistance, cleaning assistance, sometimes, depending on the hospital, not every hospital is like this, but you'll do vital signs. You'll be like a vital sign collector for the nurse. Um, you are like the eyes on the patient. So a lot of times when like patients start to deteriorate, it's the CNA that sees it before the nurse even does because you're in there so much. But there's just like a lot within your capacity that you can't do, right? That you can't. So that's why, like, for me, because like CNAs, like, they are overworked and underpaid, if we're just being fully transparent, it's just really hard. You just don't get paid for what you do. And I feel horrible whenever I see CNAs that are just being worked to the bone and they're just not getting paid for the amount of work and effort that they have to put into the career. That's all.
as a new grad, how hard would be to get into oncology?
Oh, not hard at all. As a new grad, like how hard will you begin to into oncology? I wouldn't say hard at all. I actually was an oncology PCT when I was going through nursing school before I eventually had to quit because it was becoming too much. And it's very easy, very easy. I wouldn't say that oncology is highly competitive unless you're like working at a cancer institute, where that's like all they do is oncology. But even then, I wouldn't say that it's difficult to get a position as a graduate nurse. For me, it was kind of hard because it is a lot of it's what the patient makes it. So you have a lot of patients that are very like optimistic and they are trying to live their life and love life for whatever time that they have left, depending on the kind of cancer and prognosis that they have. And then you have other situations where people are very depressed. They're very isolated depending on like how neutropenic they are, how much like how messed up their immune system is because of the chemo and the radiology or not radiology, the chemo and the you know what I mean, all of the different types of treatments that cancer patients get, that it becomes very depressing. So you could have like a really good shift with very optimistic patients and then you could have a really bad shift with um very depressed patients. So you have to kind of like be a light in a very dark tunnel when it comes to oncology. And I think that's hard.
The emotional
Yeah.
toll.
The emotional toll that it takes. Oh my God, I'm going to start crying. It was very hard for me working on oncology because there was some nights that the patients were fantastic, and there was some nights that you would come in, and then the next night you would come back and they were no longer there. And I think that's the problem with healthcare is you get very attached to people. So as long as you're okay, um, and you can be attached to somebody, but it doesn't affect you, I think that you'll be fine. I just think that for me, I become very attached to my patients, and it's very hard. It's very hard when you come in and they didn't make it. I think that's the biggest thing.
Med surge versus step down unit.
I think they're both great. Step down is just basically PCU. Excuse me. Um, Here's the deal when it comes to med surge and PCU between the two. So medical surgical, you're usually having like very lower acute patients. Sometimes, don't get me wrong, if the hospital doesn't have enough beds, you might end up getting somebody who's maybe a little bit of a higher acuity that should be on PCU, but they downgraded them just to get them out of the ER in order to get them to med surge. Trust me, it happens all the time. But typically, they should be more of like a observational kind of patient. You're just observing them, making sure they're getting their meds, making sure that they don't deteriorate, things like that. Whereas with the PCU, you're looking at a higher acuity. So they're not quite ICU, but they're not quite med surge, meaning that they might need more frequent rounding, maybe higher acuity types of medications, maybe higher acute or higher dose heparins, different kind of drips and things that they can't have in the med surge setting. So the issue that happens is it depends on what your patient acuity is in each unit. So typically med surge in the state of Florida, you shouldn't have anywhere more than 6 patients. Usually you should be between 5 and 6. And then with a PCU, you shouldn't have more than 4 patients. So somewhere between 3 and 4. However, based on current hospitals and the way that they are operating, and I'm only speaking in Florida. I'm pretty sure that they're all like this throughout the country. Based on how they're currently operating, they are operating where their med surge nurses may have 6, 7, 8 patients, and progressive care nurses may have 4, 5, 6 patients a shift, which makes it really difficult if you're caring for people that need like consistent round the clock monitoring and medications and things like that, risk for falls, confusion patients, things like that. So you would have to make a decision of like, to you, would you rather have the higher acuity of patients and then hope that you don't have as many patients each shift? Or would you rather have the lower acuity patients? And if you have more patients, it might not necessarily be as difficult as you would see in PCU. So it really depends. In a perfect environment where med surge nurses have no more than 6 and PCU nurses have no more than 4, I would say PCU just because you're going to be seeing a lot more different kinds of acuities and different kinds of disease processes, with potentially having more high risk medications and things like that. But if you're like, I ain't trying to deal with all that and I just want to get in and get my paycheck and then hopefully my patients are going to be set, then I would say med surge. So it's really up to you. Me, I'm always an ER CVICU nurse all the way. That's just because that's my background was, or is, I should say. Oh, you're a real one, and I see why you being a nurse fits you. Yeah, listen, I'm not going to like sugarcoat nursing. There's a lot of issues. A lot of issues in healthcare that, we have to overcome. And I know that there's a lot of fantastic nurses out there that are fighting for staffing standards and things that are going to make hospitals and nursing safe. But in the meantime, we have to figure out what the hard is and how we deal with the hard, right? Until we get to be in that ideal environment. And I think, unfortunately, COVID made it really, really sucky to be nurses right now, is because during COVID, basically, we were called heroes. And we were like, what was the word that they used in Florida? We were something kind of staff, like staff that was needed that couldn't go anywhere. I can't remember the name of it, but essential. We were essential staff, right? Or whatever. So like places were putting like big signs out like thank you nurses, and like hotels were like putting like hearts in their hotel rooms and lights so that the nurses could see it when they go to the hospital. It was crazy. Essential workers, that's the word I was looking for. Essential workers, right? And when that happened, nurses kind of were like, all right, well, we're in this really crappy situation. So let's just make the best of it until we get on the other side of this pandemic, right? So we were taking higher staffing patient ratios. We were doing work because we were hoping that once this started to slow down, we would go back to the way things were pre-pandemic. Well, what happened is a lot of hospitals decided, well, we worked this long with these crazy patient staffing ratios and we don't want to hire any more new nurses. Let's go ahead and continue doing what we were doing or during the pandemic and not make those adjustments to back to the safer ratios, even though they weren't really safe, but they were still better than what they were now. So you do see a lot of hospitals where nurses are working in ridiculous patient ratios or having a ridiculous team of patients that they shouldn't necessarily be caring for because they're trying to push this narrative that we are a family. Oh, we're a family. And that this is like this times are hard and we have to continue working this way because this is what it is. No, it's because you want to continue to pay your stakeholders millions of dollars every year because the hospitals are profiting because you're not hiring the staff that you need, and not getting your nurses out of these horrible patient ratios because during the pandemic they made a crap ton of money. Y'all don't even understand. We were paying travel nurses. And then, of course, the travel nurses weren't getting all of this. The agencies were taking a portion too. But travel nurses were getting paid like $10,000 a week to be in the hospital sometimes, depending on where you were. I could tell you Miami, they were paying $10,000 a week for you to be working. And nurses were taking that. And nurses were like, heck yeah. Do you know what I'm saying? This was like the perfect time to be a travel nurse. But then we came out of the other side where now everything's like going back down. And all these stakeholders got millions and millions of dollars in the pandemic, and now they're refusing to go back to what should be safe for people. So that's just my 2 cents on that. Having worked pre-pandemic, during the pandemic, and post-pandemic, this is what happens. This is what happens. So anytime, and here's the deal, y'all. I'm going to be fully transparent with you. Anytime a hospital or you go to an interview and the manager says, we're like a family here, that's probably a very toxic environment and you need to run away. Because these people are not your family. They're your friends. I mean, we make friends in healthcare, right? But anytime that the manager says to you, oh, well, like you ask them, like, what's the culture of the unit? Oh, we're like a family. Run. Don't look back. I'm just telling you right now, that is a toxic ASS environment. Don't do it. My manager used to do that whenever we would interview, and I said, stop doing that. And then she'd be like, why? And I said, because people don't want to hear that. Because they know that when you say we're a family type of environment, people know that they're going to get abused. Because what happens, let's talk about it. What happens when you become part of the family? What happens when you become part of the family? They start to mistreat you. They start to guilt trip you into, you're not picking up extra shifts or helping the team. You're not a team player. What are you doing? We're a family. We help each other out, right? So they start guilt tripping or gaslighting you in regards to that. And then when you get pulled into the manager's office, when something goes wrong, somebody says something to you or whatever, right? Then it's all like, well, you know, what's your issue? What's the reason that you're acting this way? This is not how you act. This is not how our unit incorporates. And you're like, well, your unit is toxic. And this is the reason that I act this way. And these are the reasons I don't pick up extra. And these are the reasons I don't come in. And these are the reasons I don't work for free. Right? Because at the end of the day, I'm here to do a job. You're not my family. My family doesn't yell at me. My family doesn't berate me. My family doesn't bully me. My family doesn't gaslight me. I mean, if you come from a good family, I know that there's some out there that are a little weird, but you know what I mean? Like, they're going to abuse you in some way and think that that's okay. So no, don't fall for the family bullcrap. If somebody tells you that we're a family and that we love each other and we're all kumbaya, run the heck away immediately. Ugh, I hate when they say that. Oh, we're a family. No, you're not.
And then HR get involved.
Yeah, and then HR gets involved, and then HR says, well, what could you have done differently? No, it's not me. It's my toxic manager that seems to think that we're a family and then I should be coming in for all these extra shifts, and you're not going to pay me a differential or something to come in for these extra shifts. No, absolutely not. You know what I'm saying? Because family, and here's the deal, not family. HR is not your friend. HR is not your friend, and HR does not have your back. The whole reason HR exists is to make sure that they mitigate any kind of potential lawsuits that could happen against the hospital if you were to leave or if they were to let you go. That's the whole thing behind HR. So if you say, oh, I'm going to go to HR about these issues, oh, HR will document it. HR will document it, and HR will let your manager know, but they will not have your back whatsoever. So don't try to get kumbaya with HR either, because I'll tell you right now, just based on personal experience, when I was a graduate nurse and I worked for a unit that basically put me as a charge nurse, and I got berated and yelled at by the administration and just in a very toxic situation. I went to HR, and HR looked at me in the face and they said, what do you want me to do? What is it that you want me to do? So HR is not your friend either. You just have to know that.
What is the best recommendation material to start with a new nursing student?
You just took me from this whole conversation about how much hospital family and HR sucks.
Hey, that's what people want to know. I'm just telling you what people want to know.
I learned this last night. Positive about those who help out, fill in the last minute because of shifty schedule and no shows. Yeah. HR is all about the company, not the employees. Yep. HR is not your friend. Yeah. Unfortunately, here's the deal. When it comes to healthcare, just to protect you, just so that I can give you a piece of advice on how to protect yourself, my biggest advice to you is always document everything and always send anything in an email. So if you ever have a situation where the manager pulls you in to have a conversation that maybe isn't necessarily like you didn't do anything wrong or wasn't appropriate, make sure that you send a follow-up email between you and your manager, and make sure you blind copy your personal email, because trust me, if they want to fire you, they'll fire you, and then you'll not have access to your email or anything, any of your documentation. So always blind copy your personal email. That way you have your personal stuff. But just say like, here's how I interpreted the conversation, blah, 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 blah. And then you can always put your response to what you feel about the situation in there too. Because at the end of the day, that'll be the only thing that saves you. HR is not going to have your back. Administration's not going to have your back. And the hospital's definitely not going to have your back. So if something was to go wrong or something was to happen, it's always best to have that documentation with you just in case anything was to go down, or they try to come after you. Because I have had situations where the hospital tried to pin something on me that wasn't me. Basically, I had switched a shift with somebody, and the person that was coming in for the shift that we switched didn't show up. I showed up, but they didn't show up. They did a no-call, no-show. But because it was originally my shift, they tried to pin that on me. And then they were trying to write me up as a no-call, no-show because of that. So sometimes but I had it in documentation with the other person that I said, hey, we're switching this shift. And the manager was in on it. And it was basically like a CYA for me. But you've got to document everything. You document everything about the patient. You've also got to document everything to advocate for yourself. Do people actually sue the hospitals as ex-coworkers? Yeah. I've seen people sue hospitals all the time for stuff. There was somebody, I don't remember when it was or where it was, but there was a nurse that had sued the hospital for wrongful termination, and they had a boatload of emails with this hospital about things that the hospital will make up. Because let's be honest, and this isn't just hospital, this is everywhere. If a place wants to get rid of you, they will create documentation to get rid of you. If you're ever in a situation where you've been working there as a nurse and they pull you into the office and they put you on a performance improvement plan, they call that a PIP. That is the hospital's way of getting ready to let you go. So anytime the hospital puts you, and I hate to say it, but it's true. Anytime they put you on a performance improvement plan, that is their way of saying, like, we're having problems and we're getting ready to let you go. So that's how they start creating documentation to protect themselves from lawsuits. Um, so yeah, so that's just be cognizant of that. There have been nurses, I don't remember where it was, but there was a nurse that sued the hospital for wrongful termination, and they ended up with millions of dollars, like millions of dollars from the lawsuit. So it happens.
And always screenshot or email or any document, any like internal email back to yourself, because when
Oh,
stuff go down, they lock you out.
anytime, like a lot of you will have the little phones. They'll either give you the little phones and they'll have like a little screen on it. You'll like text somebody on that screen. I had like a little iPhone. That's where I worked at one place, and the um, assistant nurse manager, who was the charge nurse, told me I could go home. And I screenshotted that and sent that to myself on my personal phone because I already knew that this assistant nurse manager was shady. So I went home early, gave them my team, and they ended up writing this massive email to the manager with myself included, stating that I had left early and was didn't tell anybody. But then I abandoned my assignment, is what they said. I abandoned my assignment. So when that happened, they were in the process of trying to reach out to the board of nursing because they also will take that next step sometimes, depending on the hospital you work at, depending on how toxic they are. But they were trying to contact the board of nursing to say that I abandoned my assignment and this needed to be investigated. Well, thank goodness I had that screenshot where she told me that I could go home early. I just needed to pass off my patients. And I saved that, and that was my only saving grace. And I left that hospital immediately. It was like a week or two later. I left immediately. That was it for me. I was done.
But always screenshot everything.
Yeah.
Email with the hospital email,
Yeah.
document, notes, and everything.
Even my pals, remember that? Remember they sent me an email telling me that I couldn't work because I didn't have my PALS certification because they had just changed a policy that said that even if you were working in the adult environment, you had to have the pediatric advanced life support certification. And then they took me off the schedule and said I couldn't work. And then because they were short staffed, they called me and said, "Oh, you need to come in today." I said, "Oh, no, Maria. I have this email from you saying that I cannot work until I have my PALS certification, and this is the day that I'm getting it. So I'm on vacation right now, and I will see you when I get back." So then they try to write me up for that too.
Yeah. Always screenshot.
Always screenshot and protect yourself. Trust and believe it will save you 9 times out of 10.
It's like high school drama times 10,000.
Yeah. It's basically, and not every unit is like this. I worked for one unit at Point Siena Medical Center. It was their PCU. Their PCU at Point Siena Medical Center. The best team I've ever worked with in my entire life. Best team. The management was fantastic. And it was an HCA hospital, y'all. And that says a lot. It was an HCA hospital. It had the best team. It had the best management. It had the best educator. If I could have stayed there longer, and I did try to extend my contract, I couldn't. They didn't have the money for it. But
oh yeah, they were so nice.
They were so nice. So nice. Best team I've ever worked for. So there are really good units out there. You just have to find those. It's just hard because you have to filter through all the bull crap. But I can tell you, having worked in ER and CVICU primarily my entire life, my entire nursing life, I should say, they're very cliquey. And if you're not part of the clique, they ostracize you really quickly. So you have to kind of like figure out like what's the amount of toxicity that you're okay dealing with. And I don't say this to like scare people from not wanting to become a nurse or not working in healthcare, because here's the deal, that happens everywhere. I worked at a construction company. They did piping and stuff for something. Don't even ask me. It was a long time ago, but they were just as toxic as the hospital. Even worse, if I'm being fully transparent. So whether you're in the hospital or you're working some other kind of job, Walmart, Target, I don't know, whatever you're working, toxicity is going to be everywhere. So you just have to find like how much toxicity you're willing to do. And the good thing about healthcare and the good thing about being a nurse is there's so many opportunities. I mean, there's an obscene amount of opportunities in the healthcare field that you can do. You don't have to stay on one unit if it's ridiculous and it's not for you. I've had nurses that worked on the unit It was like, you know what? While they were in orientation, said, this isn't for me. I don't really want to do this. I want to go do something else. And that's okay. You can say that. You can say that. But don't get through all of orientation, get by yourself and then say, I don't want to work here anymore. I want to go do something else. Make sure you make that decision before you come off orientation. Yeah, healthcare is very cliquey. Can I speak on therapeutic communication? um, Therapeutic communication in regards to your coworkers or the patients? I think that's the better question. Radiology and ultrasound, I think they're both great. I mean, they both do kind of the same thing. Like ultrasound, you're doing a lot of, ultrasounds, right? And then radiology, you're doing a lot of the x-rays, CTs, MRIs, things like that. So it's really depending on like what it is that you want to do. I don't think there's anything wrong with either one of those fields.
No medical background, decide to go for LPN, your thought.
I think that's great. So the question is I have no medical background. I decided to go to LPN. What are your thoughts? I think that that's fantastic. Simply because of the fact that LPN will kind of like nudge you into healthcare a little bit. So you're not going to have as many responsibilities as a registered nurse. Your scope of practice is going to be very different. So it's going to like give you kind of like a gateway to get in and see if that's for you and that's what you want to do with spending as little money as possible. So I think that LPNs, I don't think, even if here's the deal, if you never want to be an RN and you just want to continue to be an LPN, that's cool too. There's nothing wrong with that. There's a bunch of people that are just LPNs and are doing fantastic within the field. So it's really up to you what you want to do and where you want to take your healthcare career.
Oh, so the therapeutic communication on patient. Do you have videos?
Oh, on patients? I think with therapy, do I have videos on it? No. It is something that I need to create. Where's it's way back there. I can't reach it. Therapeutic communication is fantastic. It is a video that I think that I should do.
Are you writing your name?
Yeah. Sorry, I'm just writing that down in my notes so that I know that I need to create a video on that. So therapeutic communication is you're asking a lot of open-ended questions. You never ask why. Anytime you use the word why or you in what sounds like it could be an accusatory kind of language, it can come across as very very icky to the patient. Do you know what I'm saying? Like it's almost kind of demeaning to them in some way. So we never use the word why when we're speaking with patients, but we could use things like what's on your mind today. Maybe like paraphrasing, like if the patient's telling you about everything that's been going on, you can use language like, oh, you've been really busy today. And, it just kind of validates what it is that they're saying. I think that's the biggest thing with therapeutic communication is asking those open-ended questions, but also validating or reflecting on what it is that they are speaking about. Because we're actually right now watching a Korean drama about healthcare, which is really funny. And one of the girls on that drama has no therapeutic communication. She's very book smart. She could recite anything that she could find in a book. But if a patient starts crying and they start going like, what did I do? Why am I allowing this to happen to me? Or not, why am I allowing this? What did I do to deserve this? I think that's the biggest thing. When sometimes you're not always going to have an answer for that. And in those situations with therapeutic communication, sometimes using silence is a way to be therapeutic. Do you know what I'm saying? So in her case, she just keeps reciting books and saying like, oh, you have a 30% chance of survival and blah, blah, blah. Not therapeutic communication. So just, having empathy for the patient. Never say like, oh, I understand where you're coming from. You don't understand where the patient's coming from because everybody's experience is going to be very different. You may have experienced that same thing, but it doesn't mean that the way you experience it is going to be the exact same way they experienced it. So sometimes just saying that sounds really difficult is a lot better than saying, oh yeah, I completely understand that. It's just, it comes across different. So the biggest thing with therapeutic communication is the way that you say things and the empathy and the understanding that you put behind it. But I'll do a video on that. I'll do a video on that. What's the name of it? I think it's called The Playbook.
Yeah,
It's on
Netflix.
yeah.
It's like enough.
But I think it's called The Playbook.
Resident Playbook.
The Resident Playbook. That's it. Now, I will tell you that it is medically inaccurate. If you're looking for something that's like medically accurate, that's probably not going to be the drama for you. Doctors typically aren't doing dressing changes and things like that.
Well, in Korea, they might be.
I don't know, man. It's hard to say because I don't know the healthcare environment of South Korea, but in the United States, doctors don't usually do dressing changes unless they're a very complex dressing change. And even then, they may train nurses to figure it out.
How do you survive accelerated classes? This is the first semester she's been trying to keep her 3.0.
Accelerated classes are hard. That's why I don't usually recommend them. If you are... See, the problem is that's like a very... So the question was like, how do I survive accelerated classes? This is their first semester and they're drowning to keep a 3.0. Here's the issue. Is that there's a lot of factors that could be affecting that. So maybe, I don't know if you have like a full-time job. I don't know if you have a husband that irritates you regularly. I mean...
Proudly present, Mr. Cheung. Oh.
You know what I'm saying? I don't know if you have kids. Like, I don't know, like, your situation. So if you are in a situation where you have a lot of other commitments outside the accelerated program, you may have to reevaluate those commitments and see if there's any kind of like assistance or something that can help you with that. This is a number one reason why I don't recommend accelerated programs, because it is what it is. It's accelerated. So you get your degree faster, but it also comes at the expense that you may not be able to work. You may have to be in a situation where you may have to like drop your kids off at the in-laws or the parents or friends or whoever, you know what I'm saying? Just to give yourself a break from that situation. So that's why it's a multifaceted question that's really hard for me to answer, just simply because of the fact that like I don't know your personal situation and what you're going through. But what I would say is that you might have to look at what's causing the issue and reevaluate how you can maybe delegate some of those things to other people to help you. Yeah. Like some of you have newborns. Some of you are like just now becoming parents, or maybe you're just getting married and you have a partner.
Yay!
That really irritates you. When I was going through nursing school, I had a partner and he told me in my fundamentals class that I wasn't spending enough time with him, and that if I was going to continue to date him and live with him, that I needed to pick between him and school. Well, guess who I chose? I chose school. You know what I'm saying? So like a lot of those things happen. Like a lot of times, I will tell you, nursing school, especially in your beginning semesters, is the time where we see the most breakups. I can't tell you how many people were crying in my first semester because they either were getting a divorce or their boyfriends broke up with them, girlfriends broke up with them. Like, it was extenuating. Like when you get into nursing school becomes life. And if you don't have a partner that understands that and supports you through that, that's what happens. So that's what happened to me. Is I broke up with my ex, another frog that I kissed. And I went through nursing school alone, to be honest. I'm divorced already and ready to go. Good. See, you're already light years ahead. This is the deal. Like, nursing school, I don't think people really talk about how difficult school is, because what happens is when you go through your prerequisites tend to be a little bit easier than nursing school. If you really paid attention, you really put in the time and the effort to it. You know what I'm saying? Like there are some people that play around with it a little bit and don't really put in the dedication that prerequisites need. But typically, overall, your prerequisites are going to be way easier than nursing school will actually be. When you get into nursing school, just the sheer amount of time that you have to commit to it, just for regular programs, not even accelerated programs. I'm just talking about regular programs. You've got class time that you have to go to. You've got testing time. You have clinical time that you're going to have to go to. You've got simulations that you're going to have to study for. You're going to have assignments that are going to be due. You're going to have just endless studying of topics and concepts and trying to figure that out, as well as manage your time to make sure that you're getting everything done. It's very overwhelming and it's very difficult, even for just general 2-year associates or even 4-year bachelor's students, to really grasp how difficult nursing school is and how you're going to have to study. And I think that's what people don't prepare you for, is that sometimes you might not have to work. You're not going to be able to work, right? Full-time commitments may not exactly pan out because a lot of jobs don't want to be flexible with your schedule and the schedule changes that are going to come with that. You're going to have a lot of financial debt coming out of it. I mean, I can't even tell you, I had so many student loans. It was insane when I finished my original degrees. You may not have a partner. You may not have like a really big community. You'll have your nurses that you're going to school with, and that's really going to be your only support system because nobody else is really going to understand what it is that you're going through and how difficult it is. Because my parents, for example, my parents were like, "What are you talking about? You go to school like Monday through Friday and then you're home the rest of the time." Yeah, but I'm home doing assignments and studying and I'm trying not to lose my mind. So you're going to have parents and people that aren't going to understand or may not necessarily support you. So just be prepared for that, just based on personal experience. Really get to know your community, really get to know your people, get your people in nursing school, and just push through. And if you never talk to your nursing school friends again, it's okay. I don't talk to anybody that I went to nursing school with.
So, for a lot of people actually start nursing school in January, what materials would you recommend they have or start studying or whatever before they start?
Before you start nursing school, I have the big three. You need to know your medical terminology. Medical terminology is going to carry you very far through nursing school. You need to know dosage calculation. Dosage calculation tends to be one of those more difficult concepts for people. So the sooner you can learn it, the better off you will be. And A&P. A&P has got to be what you breathe, sleep, eat every single day, because at the end of the day, that's going to be very important. Very important as you're going through nursing school, because if you don't understand why systems do what they do and how they communicate with with each other, it's going to be hard to learn disease processes. Nursing school friends are shady. Yeah, there are some shady friends. I did go to nursing school with some not stellar people. At the end of the day, I got into the wrong friend group about halfway through the nursing school stuff, all my classes. And I ended up realizing very quickly that they weren't my friends and that they were basically laughing behind my back. And then I went to my original friend group that were nice people, but I just didn't feel accepted, I guess would be the word, in nursing school. Like I didn't feel like I was where I was supposed to be just because of the kind of people that I went to nursing school with. And that carried with me. But I found my groove when I became a nurse. Nursing school is just hard, man.
So, wisdom and suggestion for RN who have temporarily been out of floor nursing for a little bit
So wisdom and suggestions for RNs that have been away from floor nursing for a little bit.
and want to go back.
So what I would say is there are some hospitals that have something called a transition to practice kind of program, meaning that they specialize in nurses that have been away from the bedside for a little while. So if you can find a hospital that has that program, I think that's going to be tremendous for you as you move forward and get back into the bedside. But what I will say is that if you have done bedside, it may be a little bit difficult at first. But once you like really start getting into it and you start getting into the groove, it'll all start to come back to you. There was a period of time where I was working in education and then I went back briefly to bedside nursing to work in a cardiovascular PCU just to kind of like get my feet wet again, just to kind of see what it was. But I hadn't done nursing in a while, like bedside nursing specifically. After probably like a couple weeks, I picked it right back up. It was like, it's almost like, when you have that friend that you don't talk to for a long period of time. And then all of a sudden, like you get in contact with them again and they're like, you pick up where you left off. That's kind of what it feels like with nursing. Nursing's like that friend. It's like I haven't spoken to you in a long period of time, but now that I'm like talking to you, I'm like, okay, I got it. Like we're just gonna pick up where I left off. Um, but yeah, you'll pick it up. It's scary. It's scary like leaving bedside and coming back and then having to figure it all out again, but you'll pick it up. It might take you a couple weeks or a month.
Is it hard to get into CVICU as a new grad, or how to get into CVICU?
I think it is a little bit difficult to get into CVICU as a new grad. I wouldn't say that it's impossible to get into the cardiovascular ICU unit. Um, but if you want to increase your chances of getting into it, then I would say look at job opportunities if they are available for like a nursing assistant, PCT, something like that in the unit. If nothing like that is available, then I would say look to see if the hospital has volunteer hours, or maybe you could work once a week for a couple hours or something like that, just to like get your foot in the door, get to know who the management is, get to know who the staff is. That way, when you tell them, oh, I'm going through nursing school, and as long as you do a good job, typically they will hire you knowing that you're going to be an asset to the team. But you just have to figure out if that is something that you want to do as a new grad, how to get your foot in the door initially. If it's not impossible, then I would say start in a general ICU, or maybe even like a cardiovascular PCU. Would be probably better if you're trying to be specialized and only doing cardiovascular, and then move your way up to CVICU. I would also say that if they have night shift positions available, I would apply for night shift positions and be flexible if that's something you really want to do. It's all about flexibility as a new graduate when it comes to applying for jobs at the end of the day. The more flexible you are, the more opportunities you will have. The less flexible you are, the less opportunities you will have. So that's the biggest thing. I feel like that I'm definitely a loner in nursing school. Yeah, I mean, here's the deal. There's going to be these clicky people in nursing school that they're going to be like besties. And then when they finish school, they'll probably never talk to each other again. And then there's people like me and Andrea over on TikTok that's like, I don't really feel like I belong here. I don't feel like I fit in. I don't know if I necessarily um, know my people here. Like, it's weird. And sometimes that happens, but you still get through. You still push through nursing school, and you're still going to be amazing. It's just that sometimes you will feel like, what am I doing here? What did I sign up for? And am I really even supposed to be here? If you become a nurse, do you have to work bedside? No. Mm-mm. You can do anything you want. That's the thing about nursing that's so great, is that if you're like, you know what, I don't really want to do bedside, that's not something that I'm interested in, you can work in a doctor's office, you can work in you can work in a clinic, you can work in like Department of Health. I mean, there's so many things you could do as a nurse. You don't have to take a bedside job. You could do informatics, you can do case management. I mean, just so much. There's so much.
So someone say they really love nursing and want to become a nurse practitioner one day, but she heard in Texas there are too many nurses now and hard to find jobs.
Oh, I hate that that's even like a thing. So here's what I said. So there's a question, Miss Helena, you beautiful, beautiful Helena. Helena says, I really love nursing. I want to become a nurse practitioner one day, but I've heard in Texas there's too many nurses now and it's hard to find jobs. Is that true? I think just solely by like the fact that we have so many people that are going on strike and so many hospitals. I mean, if you just even look at like a hospital's recruitment website of like their jobs that are available, you're going to find that that's not accurate. Here's the deal. The media and hospitals are going to tell you that there's a nationwide nursing shortage, and that with our baby boomer population, that was people that were born, I want to say like in the 50s. Don't quote me on that. I'm not really good at that. But our baby boomer is it 60s?
Yeah.
It's before the 60s though.
50, 60.
Because my mom, I think, is part of Gen X, and she was born in 64.
Close.
She's like right on the cusp. But anyways, The baby boomer nurses are going to be walking away. They're going to be retiring and they're never going to look back. So they're like, oh, we have this nationwide shortage. But here's the deal, there's not a nationwide shortage. There is a considerable amount of registered nurses, LPNs, whatever it is, within the United States specifically, right? The reason why we are having a shortage, number one, is because there is a percentage of the nursing population that refuses to work bedside. They were part of the family dynamic for a little bit too long, got burned out, and said, you know what? I'm taking time off. And they either decided to come back at some point or they left the profession entirely and ended up doing something else. So that's number one. Or you have a population of hospitals. Well, let's be transparent. It's a lot of hospitals that will not hire nurses because they're still working with pre-pandemic numbers. Because we did it for years and years and years and said, we're okay, kumbaya, we're a team, we're going to get through this, these are my people. And then now we're on the other side and they're like, no, you can do it. Everything's fine. It's not fine. So that's pretty much where we're at right now, is either there's a percentage of nurses that refuse to work and go back to the bedside, or there's a percentage of hospitals that just refuse to hire appropriate staffing. So I wouldn't say that it's going to be hard to find a job as a nurse practitioner, especially in Texas. Everything's big in Texas. You got a ton of people out there. But yeah, the nursing shortage and the difficulty with finding jobs is just because of one of those two factors.
Oh, and expectation. Like the also new great expectation. They say like Instagram or social media
Oh,
nurses.
and then so here's the deal. Not so much now though, because now with the pandemic being gone, they actually were doing clinicals. During the pandemic, there was a lot of graduate nurses that never had a clinical a day in their life. So from 2020 to like 2023, they were doing virtual clinicals, meaning that they never actually touched a patient because they didn't want to expose any of the nurses to the COVID virus. They didn't want to have a lawsuit in case somebody got sick and something happened to them, type of deal. So when those nurses ended up coming into the hospital setting, what ended up happening was a lot of them left because they were like, oh, no. I was never exposed to this. I didn't realize that this was what nursing was, because there's a lot of shows out there like The Resident Playbook, Grey's Anatomy, like all of those shows that are hyperly unrealistic when it comes to what healthcare actually is and what it actually looks like. So yeah, unfortunately, we lost a whole bunch of graduate nurses during the pandemic time because I had one nurse flat out tell me, like, nobody said it was like this. And every TV show that I watched didn't say that I would have to take care of patients like this. So they ended up leaving the profession altogether and working in an accountant firm with their family. They never came back. So, you know, it happens.
So someone asked, what's your thought on clipboard when they go through nursing school? I guess. Oh no. Like what stuff they really need for nursing school?
Oh, God. Y'all are so cute. So somebody's question is what is your thoughts on clipboards in nursing school? So there's a couple different kind of clipboards. If you have just a regular clipboard, the one that like just opens like this, it folds in half, you're good. If you're the kind of person that's got those like huge clipboards that you can store your pencils and paper and little notebooks and
They have a 3-folded one too.
yeah, y'all are doing too much. You don't need those clipboards. The reason why I laugh is because I had that clipboard.
Oh no, clipboard, the job app. Never mind.
Oh, my bad. But for those of y'all don't need them big clipboards. Get rid of them clipboards. When we see you coming down the hallway with those clipboards, we know that you're student nurses. Throw those clipboards out. You don't need them. You won't use them when you're a nurse. If we're being transparent, you're going to shove all your notes in your pocket. Um,
So clipboard and
I'm talking about clipboard the job. Oh, I have never heard of that.
the job app.
Yeah, I've never heard of that.
Indeed, I mean they're the biggest.
Never heard of that.
Any tips for pre-nursing major? Oh,
I don't understand the question, I think,
any
because
tips for pre-nursing major? So I guess like prerequisite. Any tips like what they should focus on? I guess.
like what classes you should take. I think that that's pretty standard in regards to the school that you're applying to. Um, there's certain classes that you will take and certain ones you won't. I will tell you that if you've taken a class, if you've taken a class and you didn't do stellar in it, if the school will allow you to retake it to get better score, then I would do that. It sucks to have to take a class more than once, but sometimes increasing your chances to get into school is better than not. So I would always say get as high a score as you can in your prerequisites. So that way if you get a little bit of a lower score with your T's, it won't hurt so bad.
Uh,
How do you gain confidence as a nurse when you're starting out? I think that there's kind of like a level that you have to figure out in regards to confidence. So sometimes if you're like overly confident as a nurse, it can come across as being like a know-it-all. And then if you're too underconfident, then it comes across as you being uh maybe difficult to teach because you lack the confidence. So one, you're going to have to find like the in between. So if I would say never use comments like, "Oh, I already know that," or "I'm already well aware of that," or something like that. Don't ever use comments like that. I think because those type of comments come across as like, "Oh, you already know everything, so why am I even teaching you?" The better question is like if you come across something, you can say, like, "Oh, I've experienced that, but can you tell me how it's done here?" Right? So that way it lets them know that you've seen it, but you also want to know what the protocols and things like that are for like the hospital. Uh Asking open-ended questions, like always being inquisitive, things like that, that'll help build confidence. But at the end of the day, confidence comes over time. I'll tell you right now that I was not confident until probably like a year into being a nurse, just because one, I'm an introvert and I hated going into patients' rooms. Just having to go into a patient's room and being like, "Good morning, my name is Jennifer and I'm going to be your nurse today," was like the number one thing I did not want to do. Hated it, especially at the beginning of the shift. Once I got into the shift, I was good, but I hated like having conversations because I'm very like I'm going to stand in my lane kind of person and not really interact much, which seems weird because I have this massive YouTube channel uh, and I teach all these things. It just seems odd, but I am very introverted on the inside, like extremely introverted. So over time, that confidence will build. The more that you get comfortable, I think with the routines and the things that you're learning as you're going through nursing school and as you're becoming a nurse, that will come over time. But unfortunately, it just takes time. It just takes time, unfortunately.
any suggestion? Sorry, any suggestion or resources to study OB and pets?
Pete,
Peds.
any resources?
Yeah, recommended resources to study for OB and peds.
The thing with me when I was going through nursing school is I didn't look for specific like books or something to help me increase my knowledge on a subject. What I did is I did a lot of practice questions. So I don't have like a specific resource that I could recommend to you. I can tell you that I use Saunders. Oh my gosh, I have the biggest white hair right here. I have Saunders is what I use for all of my practice questions. I just said like question after question after question on the topics that I was learning. That's how I specifically learned. I don't know if there's like a secondary resource that will be available to you book wise specifically. That's going to bridge a lot of those gaps outside of the textbook. What I would say is that maybe YouTube videos and things like that are probably going to be better off for you when it comes to learning concepts. Because to be honest with you, I can't stand textbooks. They're too wordy. And unfortunately, in nursing school, you're going to be in situations where the professors are always necessarily the best teachers, and you're going to have to teach yourself. You know, that happens quite a bit. In my, was it Peds or OB? It was Peds. That's why I almost failed it. In my pediatric class, I ended up getting a C. I passed. C is passing. That's all that matters. But I had a professor that literally read from the slides and didn't provide any like additional information. And then when we came time for testing wouldn't even be anything that was on the slides. So basically everything was in the book. So going to class was pointless. And then when you would ask this professor, you would say, hey, I noticed that everything you tested us on is nothing that you actually taught in class. It was things that were in the book. And she said, oh yeah, that's why I assigned the reading. Or if you would ask questions, she would be like, did you read your textbook? And I would be like, yes, that's why I'm asking the question. And they would said, the answer's in your textbook. You'll find it. So not all my teachers are like that. I did have some really good teachers that taught really well, especially like my basic med-surg class was fantastic, but my Peds teacher was, I don't think, very knowledgeable.
Yeah.
And to be completely transparent, she was a hoe. She was a hoe. Because here's the deal. If I ask you and I say, listen, butthead, I'm trying to learn so that I don't fail this class because you're not actually teaching anything. And she's just basically like, it's in your textbook. It's in your textbook. That's not helping me learn. Why am I paying you? At least the other professors were a little bit nicer to me. This chick was just, I wanted to punch her in the throat some days. Yeah, I believe my instructor is a hoe. Me too. Yeah, seriously. If the instructor only reads from the slide and you ask a question and they are unable to provide you feedback, one of two things is happening. They've been away from the profession too long and they no longer understand basic nursing and can't answer these fairly simple questions. Or two, they're a hoe.
So someone asked, how did you guys study back in the days before like the ChatGPT?
How did I study back before ChatGPT existed? Okay, so a long time ago, kids, before ChatGPT existed, we had to write our own papers and do our own studying. Back when Florence Nightingale was still a nurse, who was the founder of nursing. How did I study? I cried a lot in the bathroom at the school. Oh, God, I hated it. Oh, my God. Y'all don't know how good you have it right now. You can literally type anything into these systems, and it'll give you the answer. Do you know how hard it was for me going through school and not having that? There was no YouTube videos back then.
Yeah, YouTube don't exist.
YouTube existed, but there was no nurseness. There was no nurses on it.
Right.
There was no nursing videos at all on it at all. So you were basically on your own. And that's why I said my professor was a hoe, because I literally had nothing. And I can't tell you how many times I would take an exam and then ask a question, and these hoes would be like, I don't know what to tell you. It's in the study material. I would literally cry in the bathroom for hours because it was so stressful, because you can't find the information. The information wasn't as easily accessible as it was Now,
Do you have
then
PowerPoint back then?
we had PowerPoint. There was no like Canva, like Canva didn't exist and all that, but we did have PowerPoint. But they literally, it was like PowerPoints that were created probably like 20 years ago that they refused to update. So a lot of the information was like outdated nursing practices, but they would test you on current nursing practices. And then you would say, hey, ho, your PowerPoint said this, but then you're testing me on this. Like, I feel like I should get credit. And they were like, no, you're not going to get credit because you need to know current standards. But you taught this. Why am I not getting credit? It was horrible, y'all.
So just tell people how long you've been a nurse, despite this young face.
I've been so I do look young, but I've been a nurse for a while. So I've been a nurse for November will be 14 years. Which means that 16 years ago, I went to nursing school. 16 years ago, I went to nursing school, and it was horrible. Y'all got it good. Y'all don't even understand how good you got it. I would cry in the bathroom. Y'all, I'm old. I'm an old hoe. Old nursing hoe. I would cry in the bathroom. I would like have mental breakdowns in the library. It was bad. It was bad. You're putting me off, but here's the deal. You've got the stuff you need now. You have the stuff you need. So you're in a much better position than I was back then. I can't even tell you how many, for example, my master's degree, when I was going through my master's degree, and that was fairly recently. That was
22.
29
No.
2019.
Pandemic.
It was pre-pandemic. I finished it right before the pandemic.
Yeah, right before the pandemic.
So 2019.
19, yeah.
So in 2019, ChatGPT was kind of getting out there, I think, but it wasn't there. I can't even tell you how many papers I wrote without the use of any of those systems. It literally, like on the weekend, we would not go anyplace, and I would spend literally the entire 8 hours of my day on Saturday and Sunday writing papers.
No, even every day. Let's be real.
But at nighttime. But I'm talking about on the weekend.
Oh, yeah.
But even like on Monday through Friday when I wasn't working, I was also writing them at night.
Yeah. There's no ChatGPT, no help, no nothing.
I had so many mental breakdowns, y'all. I literally cried. Nursing school was so hard and traumatic. Would I do it again? I don't know. I mean, nowadays with what we have available, I probably would, but back then, no. And they made us wear these stupid uniforms. Oh my gosh. I wish I had a picture of these stupid uniforms. I don't know if you all watch Nurse Blake, but he has a uniform that's like white and it's got a couple of stripes on the arm and these horrible, ugly blue pants. That was my school uniform. We went to the same college. So he went to Seminole State. I think he was like a year or two after me, right? We went to the exact same college. I had to wear those ugly butt uniforms every day when we went to clinical that were completely see-through. One day I wore a red bra. I had no idea it was see-through. And the patient was like, dearie, I could see everything. I'm like, are you for real? Oh. The stories I could tell from nursing school, it was so bad. Red bra like a hoe. Yes, Nurse Cheung was a hoe back then. You know why? I had to be a hoe to get through nursing school. Because if I didn't have release of my stress, I was gonna fall apart. My mental health couldn't take it. So I became a hoe. I didn't become a hoe. I was already a hoe.
So
my mom graduated in the 90s. She tells me stories about the library with no Google. Again. See, I had Google, thankfully. I did have Google, but you would still have to go to the library to find books because Google wasn't always necessarily medically accurate. So you would look something up and then it would be inaccurate and you'd be like, oh, crap. So then you'd have to go to a book. It was bad. It was bad. Bad. Yeah, you do have it good.
yeah.
Y'all are so lucky.
And everything.
Am I an RN? I earned that RN. Yes, I am. Mr. and Miss A with a tree. I am an RN. Oh my God, I'm still traumatized from it. I'm thinking about it right now.
Mm-hmm.
It was y'all are so blessed. I also come from a generation where we didn't have cell phones. That's how old Nurse Chung is. I don't know when the first cell phone came out, but I didn't have a cell phone growing up. I didn't get a cell phone until I think I was 14 or 15. That was like when I got my first cell phone. But I was part of a generation where we had car phones, where the car phone was actually like built into the car.
And toilet phone.
And toilet phones.
Yeah, me too.
Pre-internet, we didn't even have internet. That was when you used to have to go outside and look at trees. I don't think many of you go outside and look at trees anymore. Since the invention of the cell phone and the Google. Beepers, yeah, I had a beeper. If I was getting into a fight with my boyfriend, I would have to go to a payphone and put in quarters to call them because my mom would be on the phone or they would be using the internet, and the internet required dial-up, which required a phone line. There was a point in time that my mom got me my own phone line. So there was 2 phone lines in the house just so we had a second phone so I could make phone calls. I'm part of the generation where you had to pay for each text message you sent. Nowadays, text message is unlimited. No, every time I sent a text message, I had a limit. And if you went over that limit, they charged you for each text message you sent. I'm the Dewey Decimal System old. No cell phone, I had a pager. Yeah. And you would have like certain like numbers meant certain things, like 143 meant I love you. And then like, you know what I'm saying? Or you do like 8008 for boob. You know what I'm saying? Like that's part of the generation I'm from.
Can you pop up on the message me? A lot of people asking for ATIT resources.
So a lot of you on the TikTok side are asking about ATIT's resources. I put on the bottom of your screen, there's a little direct message. Right now, if you want like access to the study guides, the freebies, the videos, things like that, Mr. Cheung's over there. He can answer your questions, point you in the right direction. Pay phones, rotary phones, yeah. Call me after 7, yeah. Y'all ain't ready, man. I'm part of a different.
Did you pass NCLEX the first try?
Yes. Did I pass NCLEX the first time? I did. So it was. And I cried at that too, to be honest. So I took the NCLEX the first time. I got 81 questions and then it shut off. So that means one of 2 things. Either you pass and they didn't need to give you any more questions, or you did really, really bad and you failed and they just decided to not even give you any more questions because you weren't going to be able to pass. And with the thing with NCLEX, then versus now is they don't give you your results right away. So ATITs, depending on your school, will give you your results right away if you passed or failed. NCLEX will not give you your results. They will hold on to those suckers for at least like 48 hours before they release whether you passed or failed. So I left literally crying my eyes out because I'm like, I screwed this up. They were asking things I had no clue about. But I passed. I passed the first time. Don't ask me how many I got right because I don't tell you that either. Did I try the NCLEX trick? Yes, I did. But I think the thing is like when you've been so traumatized for 2 years of your life going through nursing school and you do the NCLEX trick and it works the way that like it tells you passed, you're still in denial that you passed. Many of you are going to go through nursing school and you're going to learn about the 5 stages of grief. So when I took my NCLEX, there's 5 stages. There's denial, there's anger, there's bargaining, there's depression, and then there's acceptance. When I went through nursing school and I took that NCLEX, I was in denial that I passed. I was angry because I thought that test sucked because it didn't have any of the questions I thought that was going to be on the NCLEX on it. Then I started bargaining and I was like, please God, if I can just get this, I'll live a good life, right? And then I got really depressed waiting those 48 hours to actually get my real results. And then I got excited. I accepted it. But you will learn about the 5 stages of grief. And you will experience it, whether it's nursing school related or not, but you will experience it at some point in your life. So what's the trick? So the trick is that if you take the NCLEX and you go home and you try to re-sign back up to take the NCLEX again, if it doesn't let you put your credit card information in to sign up for a second time, then you pass. However, if it does let you put your credit card information in, there's a chance that you didn't pass. It's been pretty accurate since I went through nursing school. I mean, it seems like people are still using that trick. But that's I think it's called the Pearson VUE trick is what they call it.
Mm-hmm.
The Pearson VUE trick. Did I do my ADN or BSN? I did my bachelor's degree, but I did it concurrently with my associates, so it took me 2.5 years. Yeah, Deidre says there was no cyberbullying, so they beat you up in person. That's what happened in nursing school for me because we didn't really have a whole lot. I think MySpace still existed back then, Facebook. I mean, there wasn't really like a whole lot out there, but like, yeah, bullying was done to your face and not online. I almost would rather them have bullied me online because then I could have blocked them than bullied me in my face.
Yeah, it is accurate. It's the method is still accurate.
The Pearson VUE is still accurate?
Yeah.
Yeah. It doesn't seem like they ever did anything to make it so that you couldn't do that. So I think that's like their only way of giving nursing students kind of like a peace of mind, potentially. Anything could change. I have heard of people doing that and thinking that they passed and didn't pass, but it's very rare. It's very rare that happens. It's crazy. Well, dang. Has it been 2 hours? Wow. We don't ever do 2 hours, but we had so much fun. It was crazy. All right, y'all. I think that I am going to log out. I have to go to work tomorrow and go deal with life in the hospital and education in the hospital. We will be back. We're going to do this every Sunday. So the Sunday shift exists. We did end up missing it last week. So I guess this extra hour made up for us not being able to do it last week because I was really sick. As you can tell, I'm still kind of sick. Still. But yes, so we will be back tomorrow for my ATITs, folks. We're going to be doing science, reading, and math this week. Science is going to be cell structure and genetics, I think. Reading is going to be reading. I can't remember specifically what it was. And math, I think, is PEMDAS. Yeah, PEMDAS and a whole bunch of other stuff. So we're going to be covering that.
Halloween style.
Oh, yeah, we're going to be dressing up. I wanted to be a hoe, but Mr. Cheung said I couldn't do it. I wanted to get the outfit from Pretty Woman and wear that on stream, and then Mr. Cheung was like, nah. He's so rude. He is so rude. Mm-hmm. I love Julia Roberts, and I loved the hoe that she played in Pretty Woman, and I felt like I should have been able to dress like it.
Yeah, you're a pretty woman, but that is for us.
No.
Not for them. Those would be pay-per-view. Extra pay-per-view.
Oh my gosh.
Okay.
This is not OF. I love Pretty Woman too, and I love her outfit. She was the best hoe that I've seen. So yeah, I won't be a hoe. Sorry, I'm gonna be other things that are more appropriate. If you're mad, blame Mr. Cheung. Blame Mr. Cheung. All right, y'all. I'm going to be logging off here. We'll be back tomorrow with more ATITs content. And then if you want to come back and talk about all things healthcare, get some laughs in, get some talk about reality and what it actually looks like, we'll be back next Sunday to do this again. So I hope that you all have a wonderful rest of your Sunday, and I will catch you